MD codes yesterday and MD Dyna codes? Good for you. Good for you. The vast majority only is left or went out for eating. I have some questions here that, Eugenia, give me 10 minutes to answer the questions, okay? Question number 1. When you assess a patient, do you assess directly in the patient only, or you take their picture to before and then analyze? Usually, I take pictures. So the patient comes in my office. Before talking to me, they take some pictures. And then I do the consultation with the mirror first, and then I show them the pictures. Question number 2. If there is a patient that has gummies maio that we want to correct with mechanical block put filler, in the other hand, she needs volumizing on CK3, which we put on the deep mailer that facilitate the muscle. So what I would do is this. Usually the deep mailer fat pad is under the levators. But when we treat gummies maio, we put above the center so that we stretch the fibers. Is an exception. Do you prescribe any antibiotics after filler injection? Never in my office, never. But when I am in tour, I prescribe for everybody. Because here we have a temporary clinic with cameramen, we have a lot of people, so I prescribe. In my office, never. After I inject tear trough, sometimes the patient complains that there is more prominent bulging in the tear trough, only when the patient smiles. Is it because I'm more powerful? No, it's wrong placement. This is an interesting question. If a patient really cannot afford 4 ml per session, what would you do? Do you prefer to hold until they can afford 4 cc or inject the priority first choose first? Make it significant for 2 cc so they will come back to have the next session. I think everybody can afford 4 syringes. I think so. Yeah, but you know, sometimes I lower my profit margin. I want to have a great result for my patients. Because there are some doctors that they want to charge very high and they want to get as much profit as possible. It's not a good idea. We have to focus first in the result. And for a great result, we have need of material. So this is another CK3. Okay, so when we inject CK3 on the bone, it means below the muscle. So the lip elevators become more powerful. True. So that means we cannot inject only CK3 down to the bone. Sometimes no. We have to do deep and then above the muscles in the case of gummies maio. Do you understand the point? So when you first injected the patient with gummies maio with volume with cannula, you said it was not on the deep mailer fat pad. Yes, it was not. It was above it. How do we know we are injecting on that plane? Angle, right? So if I put the cannula towards the bone, I'm going to be under. But if I angle towards the surface, I am above. Okay, my patient is, during the aspiration on temples and nasal fold, should we aspirate and stop and then count 5 seconds? No. What I try to do is this. I put the syringe and I start, aspirating.